Today we'll learn how to plan MRI of the lower leg step by step. This scan is extremely important for evaluating muscle injuries, bone marrow edema, fractures, and soft tissue lesions. In this video, I'll show you how to plan the sagittal, coronal, and axial planes, and how to improve overall image quality for better diagnosis. So let's get started with MRI of lower leg planning.
T2 stir coronal 4 mm 460 FOV. Plan the coronal slices on the sagittal plane and angle the positioning block parallel to the tibial shaft. Verify the positioning block in the other two planes. Ensure an appropriate angle is set in the axial plane, aligned with the right and left shafts of the tibia. 2 TSE sagittal left. Plan the left side sagittal slices on the coronal plane and angle the positioning block parallel to the shaft of the left tibia. An appropriate angle must be given in the axial plane, vertically across the tibia. Slices must be sufficient to cover the left lower leg from medial to lateral. T1 TSE axial. Plan the axial slices on the sagittal plane and angle the positioning block perpendicular to the shaft of the tibia. Verify the positioning block in the other two planes. An appropriate angle should be applied in the coronal plane, perpendicular to the right and left shaft of the tibia. Ensure that the slices cover the entire lower leg, from the knee joint down to the ankle joint. In case the pathology is localized in one area, perform axial slices only in that specific region.